5 on your health tonight, a new tool to help more people survive extreme heat. It is under development right now at Mass General Brigham. Leading the research is the Chief of Emergency Preparedness, Dr. Paul Bittinger. Thanks for joining us, Doctor.
Thank you so much.
Yeah, great to have you. So I'm sure you've been outside today. You know it is hot. Does 90 degrees in Boston really qualify as a real emergency?
Yeah, I think the question is actually the 90 degrees and who it's affecting. So what we know is that lots of people do fine when it's 90 degrees outside, but people who are older, people who are younger, they have more issues. And actually, some things that people don't necessarily think about, certain medications you take, even common ones like blood pressure medicines, medicines for depression, they make you more vulnerable. And that's part of the emergency is the risk factors that some people know about and some people don't.
All right, let's talk about this new tool. How does it work?
Well, so what we want to do is really figure out those risk factors. We have a lot of that data in health systems. They know, of course, people's age, medical conditions, the medicines they take. Actually, what's also important is where they live. There's this thing called an urban heat island. Communities that have more asphalt, more concrete, more built environment, they can actually be 5 degrees hotter than all the rest of the communities around. And so using that data about where people live and their other risk factors, all protected inside the healthcare system, so this data doesn't leave the healthcare network. We identify who's at risk, and then we communicate with them, not just to let them know they're at risk, but actually also help them know how they can protect themselves.
So what do you anticipate this tool would mean in terms of, helping local hospitals and emergency rooms?
Yeah, in the emergency department, we see, of course, people with acute heat illness, people who get too hot and have heat exhaustion, sometimes heat stroke. But again, we actually see rises in presentations of people with all sorts of chronic conditions like heart disease, lung disease. All of those things are made worse by the heat. And so we hope that we will actually keep people out of the emergency department, keep them out of the hospital by letting them know again about their risks and importantly, letting them know how they can protect themselves.
All right, Dr. Bittinger, thanks so much for your time. We appreciate it.
Thank you.